Hi, I'm Dr. Brian Brown with Core Chiropractic. Today is education on lumbar disc and how we at Core Chiropractic diagnose if you have a disc injury. So what the disc is, so you have a segment of a spine here. You have your vertebrae and you have this disc which is right between the middle right here. It's made up of cartilage and gel material. How it get damaged is due to it can degenerate. Bad pressure, acute pressure can also cause it to get damaged as well, to where it herniate or bulge or get inflamed. So how we diagnose it, I'm gonna let you know 3 tests that we're gonna do. So the first one is called Valsalva. So it's more about the intrathoracic pressure. One of the easy things is to ask you to cough, because what that does is create this quick acute pressure that pushes back on the lower back. And if there's pain or if there's a symptom that shoots down the legs, then we know that's a positive test for Valsalva. So I'm gonna ask Dr. Wynn here to demonstrate. So what I want you to do is not let a lot of air leave. I want you to hold as far as nose and mouth, hold your breath there and give us a cough. Okay, so any pain in the lower back?
No.
No, all right, good. So he doesn't have any acute with a good Valsalva, negative Valsalva test. The next one we like to do is what's called a slump test. So what we want to do with this one is create a flexion into the body. So I'm gonna have you flex and slump down, and you want the head down as well. So sit back a little bit more for me. So I'm gonna add even more pressure to his slump and also on his head, and I want him to lift the leg straight up. So lift your leg straight up, and I'm gonna put this into more of a flexion here. Now, a positive test, you can sit up for me. A positive test for that is if it creates pain or he can't get his leg all the way up. With that simple test there, and when we recreate it, I'm gonna have him do that same thing, but I'm gonna come up off a little less of a pressure straight down and ask him to do it again. And if that pain is lessened or if his symptoms are lessened, then we know it's a positive slump test. So the last test is called Milgram's test. I'm gonna have you lay on your back face up with this one. This puts pressure into the lower back, into the disc. So keep your legs together, feet pointed straight up. So what you want to ask the patient to do is to hold their legs 2 to 4 inches off the table, both up at the same time. And you want to try to hold that for around 30 seconds. If it creates pain in the lower back or if those symptoms shoot down the leg, we know it's a positive Milgram's test there as well. All right, you can relax. And that's how we diagnose the lower back disc injuries. If that's something that you're experiencing, definitely give us a call. Let us know when you want to come in. If you want to come in, then we'll get you treated and see if you can get help with that lower back. All right, we'll see you next time.